Good afternoon, everyone. Thank you for being here today. Since this is very special, this is the last one for the year, or the calendar year, not the academic year. And we have a very special presentation for you from the man who does not need any introduction, Dr. Degenhardt, who is a KCOM professor and the newly minted Vice Chancellor of Osteopathic Research at A.T. Still University. He will give us an update on what it means, what whole person healthcare means from an NIH point of view. Thank you for teaching us all you know, Dr. Degenhardt.
Thank you, Dr. Roy, for your introduction and for allowing me to be part of this year's Research Nexus. I had the fortunate opportunity to represent the university at NIH, and this presentation will give you information about what I learned at a meeting that I attended in November. And it is, let me go ahead and share the screen. Okay, everybody can see that okay? Okay. All right. So whole person healthcare. I mean, that's an idea that probably was not part of any of our professional educational programming. As a DO, certainly that was something that I was a little bit more part of my training. When we think about this term as a university, we certainly should appreciate that this is a much important part of the identity of this university, because even in our mission, we talk about the university being committed to continuing the osteopathic heritage and focus on whole person healthcare. Often, when we see this, and we may not be, from a different area than in osteopathic medicine, we can very easily kind of isolate this to, saying, well, that's just part of that school's identity. It's part of the history of the university. So, but does this really represent, me and who I am and my area of expertise? If we delve a little bit more deeply into this from the ATSU perspective, and this is all coming from our website. So this is how we are identifying ourselves to the world. So the university is focused on integrating the founding tenets of osteopathic medicine, which includes body unity, mind, body, spirit, or holistic perspectives. Body is capable of self-healing, self-regulating, health and health maintenance, and in a relationship of structure and function. If we go a little bit more closely looking at how this then is disseminated within the university, we state that this university instills within our students the compassion, experience, and knowledge required to address the whole person and shape healthcare in communities where needs are greatest. We're inspired to influence whole person healthcare. The graduates contribute to the future of integrated care while also leading to a selfless passion in the communities they serve. If we go more deeply into our website, we talk about humanistic healthcare based on an integrative approach that includes the body, mind, and spirit of each patient, and that these three elements work in tandem to provide more thorough and highly personalized healthcare delivery model that promotes wellness and meets the health needs of each patient. This is not, from our university perspective, something that is isolated to one college or two colleges of the campus, but is part and disseminates across all of the various programs that the university offers. The university promises that each program from audiology to dentistry, family practice to public health, integrates the principles of whole person healthcare into its curriculum and emphasizes the important role of health education, health coaching, and well-coordinated treatment plans that foster collaboration with each patient. I I've written a couple of chapters in the Osteopathic Foundation's textbook that will be coming out in 2025. And part of that, I looked at this idea of mind, body, spirit, and tried to see where does this relate to the osteopathic profession now. And what I found, it is no longer just an osteopathic thing. I did a search and found over 1 billion sites that referenced mind, body, and spirit online a year ago. And when we look at the definitions of holistic healthcare, which are completely separate from those that would have been generated by the osteopathic profession, we can see that this idea of a holistic healthcare is far more comprehensive, being far more engaged by the healthcare system in general, and not just an osteopathic idea. And so I want to share with you how whole person healthcare is now being looked at from an NIH perspective, and particularly within the National Center for Complementary and Integrative Health, which is currently under the leadership of Helene Langevin. And most of this work that I will be giving you is really out of the work that she has been able to do over the last 5-7 years of her time as head of that center. So just a little history about the National Center for Complementary Health. And I think this helps us to appreciate, where holistic healthcare is from a national perspective. So in 1991, Congress passed legislation and set aside $2 million to establish an office, which they established in 92, called the Office of Alternative Medicine. And I think part of the reason why that was done, this was because of the senator in Iowa who, as a result of his constituents in the chiropractic arena, really, kind of pushed this through the legislature. By 1998, because of the acknowledged popularity of alternative medicine, they established an actual national center for complementary and alternative medicine called NCAM. And just earlier this month, they celebrated their 25th anniversary, and they had a very nice day program on that. If we can look at the things that they've accomplished during this 25-year period, they are listed here. And you can see they did studies on St. John's wort, acupuncture, glucosamine and chondroitin echinacea, chelation therapy, published them. We're collecting a lot of surveys on CAM. And as we progressed, we see that they're starting to engage with the veterans of the Department of Veterans Affairs, the National Institutes of Drug Abuse. They're starting to expand their work, because in that earlier work that I just kind of outlined, you can see that it's really just doing typical NIH research on things that would be consistent to a pharmaceutical model that they're very accustomed to, a very basic science type of mechanistic approach. And really, they weren't very pleased with the success that they were getting. They were getting some outcomes, but was that really capturing, the essence of what complementary and integrated alternative medicine at that time was about? And so they began broadening their scope, and they went and funded 13 research projects that involved the National Institutes of Drug Abuse and Department of Veteran Affairs, and we'll talk about outcomes of this early funding that would occurred about 10, 11 years ago in some later slides. And they also then labeled themselves as the National Center for Complementary and Integrative Health versus alternative complementary and alternative medicine. So they really are seeing that their role is how does the work that's being done in complementary approaches really needs to integrate and not just be separate from or an alternative from the current healthcare system. And so they began working with other centers, other portions of the government, and announced the Pain Management Collaboratory uh, in order to start looking at issues associated with the opioid epidemic. They also began a program called Know the Science, which was designed to clarify and to explain to consumers the scientific topics related to health research. And I think any of us who lived through the pandemic know that there's a significant divide between what goes on within the scientific world and what is understood within the general population. And so this is certainly true when it comes to complementary and integrative approaches. In fact, it's probably even more so because there's a lot of just personal opinion and anecdotal reporting that kind of dominates this particular aspect of healthcare. So, an additional outcome in later part of the uh, 2016, 2017, NCCIH announced that they were co-funding the HEAL initiative, which is helping to end addiction long term, looking at behavioral interventions for primary and secondary prevention of opioid use disorder. Now, for those that follow NIH, they were the first organization that really brought in strategic planning as an important part of who they are. Prior to NIH doing that, it was really isolated to a military um, aspect of the government, which began shortly after World War I. Since NCAM started, we are now on the fifth strategic plan that's outlined here. And some of this is just boilerplate off of what would be the strategic plan of NIH overall to advance fundamental science and methods development. That will always be, one of the driving goals of NIH and National Center for Complementary and Integrative Health. But here, when we look at the next objectives, we begin to see how much this idea of whole person healthcare is shaping the initiatives being done by the NCCIH. So the second objective is to advance research on whole person and integration of complementary and conventional care. So really looking at an integrative model versus an alternative model, and using research as a way of helping promote appropriate integration. The third objective is to foster research on health promotion and restoration, resilience, disease prevention, and symptom management. Certainly, we can look at these terms and see how they significantly overlap with ATSU's focus in the type of clinicians that we are producing. The fourth objective is to enhance the complementary and integrative health research workforce. And this has been an area that I think the NCCIH has definitely seen as a significant weakness. And I think it might be something seen across multiple centers. How are we bringing along the next round of clinician researchers to really help to advance the field of medicine. And then lastly, to provide objective, evidence-based information on complementary and integrative health. So one of the important factors that Dr. Langevin did is to reach out across the other centers of NIH and other federal agencies. And as other agencies had done, she actually has built relationships with 19 other institutes, centers, and offices, including the Center for Disease Control and the Department of Veteran Affairs. And here you can see that the scope of centers, institutes, offices that have committed their not only their partnership, but also a certain amount of their resources to promote research and whole person research. In fact, she has secured an additional $18 million by building these collaborations with these other centers for research within the NCCIH, which I think is something that was commonly done in the other centers, but is only beginning to be leveraged with the NCCIH. Now, this is an illustration, I think, of the typical process NIH goes about in doing its research. When we look at various approaches, they really, focus down into more and more the reductionistic model, going all down to molecular and submolecular, research to understand mechanisms, pathophysiologies, and so forth. And while this is certainly a component of what is outlined within the 5 strategic initiatives within NCCIH, it really only covers one of the 5. So how does this manifest? And so here's an example of if we have our typical patient, and if we're trying to understand things from a molecular level, and we get a sense of what we think is the ideal molecular level, and then we place upon them, factors that are well known to create less healthy states: poor diets, sedentary lifestyles, psychological stress. It will cause a change in that quaternary molecular shape of that, whatever part of the body they might be looking at. Could be the brain, the cardiopulmonary system, the GI system, or the muscular system. And so from a traditional NIH perspective, they would say, well, what is it that we need to do to try to get that molecular structure more back to what it was in its normal state? And so they will often look at areas on these molecules that they might be able to bind to, that might then be able to create a change in that shape to make those molecules work more healthy. And so this is an example that they may have identified receptors on these molecules that they could create a drug to connect to them. And if that drug connects to them, that it may allow for that to form into a shape that it would function better and as a result be healthier versus that less healthy state. Is making sense to everybody? Does that make okay? If there's a question, please raise your hand, and Wendy, if you identify one, please stop me and I can address it at that time. Okay. So when we see how this manifests in the healthcare system, it basically means we now have drugs that can bind to different molecules that can help, bring that shape back into a more healthy state. And so we would have some drugs that would deal with the central nervous system aspects, other drugs for the heart, other drugs for the GI system, other drugs associated with the musculoskeletal system. And all of those would only be, trying to stretch and bring that molecule closer to the shape, but still it is distorted. So it's not returning the person back to health, but it may be healthier than the less healthy state than without having that medication on board. So within the current perspectives of NCCIH, how can they adjust their research model from honing into this molecular, very controlled system that they're very comfortable in having decades of experience with, into a model that focuses more on synthesis and integration and able to not only begin to address whole person related phenomenon, but actually taking it farther and looking at community and global health issues as well. And so they're saying, well, within a holistic health perspective, and if we look at the three major factors that seems to distort molecules that create less healthy states, the intervention should not be pharmaceutical, but perhaps it should be exercise to deal with sedentary lifestyle, better diet to deal with poor nutrition, and mindfulness activities to deal with the levels of stress that is part of our 21st century lifestyle. And they believe that by doing that, that is going to cause molecular changes that's going to bring that system back to or close to the normal molecular structures for the various organ systems that may be in a less healthy state as a result of, bad habits. So these are the two options. And so the traditional option of the pharmaceutical perspective is looking at using a drug to try to bind to molecules to get them to a more normal state, or at least some component of that molecule to line up better, but having, other areas that certainly still remain very distorted. But in doing that and making this change, does it have other effects? What other side effects, adverse events, or kind of the term of off-target effects that kind of make it less negative? Um, that we know that all pharmaceuticals have a certain amount of, and as you add more and more drugs into the system, that the likelihood of these adverse events just become far more likely. And actually, the research I've seen guaranteed when you are taking more than 5 medications at one time. And I have patients that come in with 2 pages of medications that they take every day, and it's just astounding. So in that whole person health perspective, where we're changing lifestyle and we're trying to reestablish normal structure, which is very, interesting within that osteopathic framework of structure function on a molecular level, not just on a whole body perspective. It does have meaning from a molecular perspective. There, we may be able to completely, reverse, but there may be aspects of those molecules that have been changed and are no longer able to reestablish its structure to optimize its function. And so there are potential off-target effects, and they may be positive, not just negative as well, as we look at this type of intervention model. So when we look at chronic stress, poor sleep, poor diet, sedentary lifestyle, and we can look at that these factors influence multiple organ systems, not just one. When we look at dealing with psychological, nutritional, and physical interventions, that integrative health approach, that whole person health model that the osteopathic profession was certainly built upon over a century, and empowering a patient with self-care and having multi-component interventions versus just pharmaceutical interventions. This is really the niche that the NCCIH is really trying to prioritize for not only its current but future strategic plans. One of the terms that were used in their strategic plan is the term resilience. And this is one that is certainly very relevant to the ATSU identity and priorities, but may not be something that is as well known or appreciated because it's a relatively newly new term for this purpose. So in this diagram, we have outcome measure on the y-axis and time over time, time at the y-axis. And so if we're just looking at, our life, and we might as well look at this individually, it helps it to have relevance. We can be doing well for whatever period of time. We can call that youth. But at some point in time, we are placed and we start experiencing chronic stressors. We graduate from undergraduate school and we start establishing long-term relationships and the complexity associated with families and so forth, and stress starts rising, that a lot of times our health slowly begins to deteriorate. And there are other times where we do pretty well, and all of a sudden, a new strain comes out. COVID-19 hits the world, and all of a sudden we are placed under an acute stressor, and we dramatically drop in our overall health quickly. In our current model, we look at our interventions. These are three different interventions that would potentially illustrate what would happen when we used various types of medications, and certainly do not get the impression in my language that I'm not supportive of that pharmaceutical model. It's just right now there are areas where we've been very successful with the pharmaceutical model, and there are other areas where we've not been. And when we're dealing with chronic conditions, which are the most prevalent of healthcare challenges and the economics associated with healthcare industry, that the pharmaceutical industry has not been as successful. Sometimes it can show some improvement, but it doesn't make a significant change in the overall loss of what has happened over time. Sometimes it might just be able to maintain or slow down that trajectory. And if it's not quite the right drug for the right problem, then we are looking at that, things would drop off even faster. So from the NCCIH model, the question is, can I advance the slides correctly? No, the question is when we look at resilience, the question is how likely is it that our intervention is going to return us back to where we were before the chronic stressors and acute stressors occurred? And so there are three different terms that they looking at adaptation, recovery, and actual growth as a result of whatever intervention that might be. And that is a sign of resilience. How much resilience is there in that body in order to not just, manage the condition, but actually adapt to a level that promotes more normal function, that actually promotes full recovery, or not only recovery, but actually grow into even greater health. That's the idea of resilience. And then we have the ability, how well have we taken care of ourselves that we actually resist, the chronic stressors or the acute stressors. And so when we look at resilience, if this idea is of interest, this article here that was written by Dr. Langevin in the journal Stress and Health, it is a very good read to really get you up to date on these terms, and how that relates to holistic healthcare. So when we look at resilience from a physiologic perspective versus a psychological perspective, if we're resisting an insult, that's a demonstration that we have good homeostatic mechanisms, or that we have good emotional stability to resist those stresses. To be able to recover, looking at repairing and restoration. And from a psychological perspective, grief work would be a good example of promoting resilience or leading to resilience. Adapting, how well do we manage, does our body make changes in its homeostatic system to deal with the problems? And so that brings in issues of allostasis or plasticity, where we get improvement, but we don't completely get out of the problem. And so how do we learn from a psychological perspective to cope with that, and still optimize our physiological functioning, even though we don't completely recover? And then growth, where we actually go beyond the health that we had, and actually, get to higher levels of health. And Hormesis is a term that is a new term, has Greek roots that basically, is a sign of focusing on health as the primary way of treating these conditions. So how can we measure whole person physiological and physical network changes over time? So from NCCIH, they believe that it begins is to break down the silos that have been created by looking at pathologies of organs or organ systems, and begin, while not eliminating our reductionistic approach, going to tissues and molecular processes that is part of that overarching goal of NIH, but to begin shifting aspects of our research model, looking at behavior and lifestyle, as I've just mentioned, looking at social determinants of health and cultural factors, which clearly this institution appreciates and is really trying to empower our influence in that area. And then going even into larger scope of research. So how is that being illustrated currently, and where will that take NIH in the future? So first of all, to do research, we have to have outcome measures that are reproducible, that are comparable, that are generalizable, and so forth. And really, there was no outcome measure that could be used for whole person health. And the NCCIH, and we'll talk about this funding in a moment, funded a organization to look at this issue, and they are in the process of developing an index, an outcome measure, a validated outcome measure looking at whole person health, which they call Whole Person Health Index. And this is part of their All of Us research program, and it's a very extensive program, as you can see, with the number of participants and so forth. And they started a line of funding called their REACH grants. So this is research across complementary and integrative health institutions. And, and for development of virtual resource centers. And the rationale behind this goes back to their strategic plan. And so I want to highlight that their strategic plan, the last year of their strategic plan is 2025. They're already outlining out their next 5-year strategic plan as we speak. And their what they call cross-cutting objectives, I guarantee is going to have even a greater level of influence in their next cycle for their strategic plan. And we can see here in red that one of their major objectives is to enhance the complementary and integrative health research workforce. And that is what the REACH grants is all about. Is can they support the development of this uh, um, workforce? So there are two strategies that this grant opportunity have. Their first strategy is to support research training and career development opportunities to increase the diversity and number of well-trained scientists to be able to provide the level of research that NIH expects. And then to foster interdisciplinary collaborations and partnerships at individual and institutional levels. We are all probably very familiar with the traditional funding for training and career development at NIH. And these various awards have been in existence for a long time. But the reality is that these have not provided significant impact in addressing the limited number of researchers within the complementary and integrative health field. And so these REACH resource centers, they feel is going to be more successful at doing that. So what are these resource centers? They are creating scientific hubs, which we see in the center in blue, and then they create institutional partnerships, which we see around the periphery, which will support research activities and research training for faculty at accredited complementary and integrative health clinical institutions. And through that, they will provide resources for clinical research aligned with the NCCIH strategic plan, looking at health promotion, restoration, resilience, disease prevention, whole person health. All of those labels are directly out of our identity as A.T. Still University. And clearly, it should be something that should be hopefully resonating with all of us at this institution. They recognize that as people within these types of accredited clinical training institutions, it doesn't allow us the luxury of taking part in these traditional NIH training programs, that we really need a different mechanism for that. And so their goals for these research centers is to, as I said, to improve the quality and quantity of the grant applications, because to date, they have had fewer numbers and definitely limited quality that they often could not fund. They want to aid in the formation of multi and interdisciplinary partnerships, because they feel that what is necessary for institutions like ours is to partner with those, R1 level research institutions that have the skill sets to deal with the methodologies and have the experience in being successful in managing, research at the level that is necessary to have a meaningful impact from an integrative health perspective. So to enhance that research environment by partnering clinical institutions like ours and to expose more students to research, and to promote a pipeline for clinician scientists to gain that expertise within a system that is feasible for clinical institutions, educational institutions like ours. So the first grant, REACH grant, was funded in 2023, and it went to the RAND Corporation. And here you can see the 17 member institutions at 20 different locations that are part of that grant. And it is highly dominated by naturopathic and osteopath and chiropractic institutions underneath the RAND Corporation. And they have met the requirements for the REACH Center Award. So they have developed a program, collaborative research community. They have developed core research resources for people within their network. They've developed research training and mentorship programming to expand access to the resources that they have available within their community, and to expand partnerships over time. And so they have newsletters and a very active website that we all probably should get familiar with to see exactly what's available there and how that might be leveraged in our individual areas to improve training and scholarly activities within our institution. I had mentioned earlier about this need of having an outcome measure for whole person health. And this is where it's at right now. The RAND Corporation was specifically given this task, and they have made significant progress. In fact, they have tested this in many environments. They've worked through a lot of issues of the validity and reliability aspects of things. They are now at the process of trying to make sure that they are doing statistics and are generating a visual that will help people understand what the data means. And so right now they are using a radar plots to try to show how, based off of this area of the radar plots, I guess I did not include that. And so that's what's happening with the RAND Corporation. They have their second round of grants. They were submitted October 1, and we are aware of three groups that have gone into it. Johns Hopkins University led one. University of California, San Diego led another, and Duke University, who brought us on, A.T. Still University, as a full primary investigator role with that grant as well. And so we are already, as a university, reaching out and collaborating with these major institutions to try to become an active member of this direction of research. Okay, so in 2025, what can we expect? So they're putting on a national health interview survey, which they will hope that data will be available by the summer of 2026. I mentioned what RAND is doing in developing what will be a major outcome marker for holistic healthcare, and what they're doing is right now dealing with the strengths and weaknesses of the scoring algorithms for this particular index. Okay. So they also put forth another initiative called the Methodological Approaches for Whole Person Research. And this is being led by multiple centers institutes within NIH. And it, um, let's see, October 1, they had their letter of interest uh, were due, and the applications were due November 1. So it was a whole month from putting forth the letter of interest to having the application done. And the application was involving four different kind of uh, goals to look at how to study interconnected systems through observational studies, another looking at how to study the impact of single component interventions or manipulation on multiple interconnected systems, to investigate the impact of multi-component interventions or therapeutic systems on a single outcome, and how to examine the impact of complex multi-component interventions on multi-system or multi-organ outcomes. So I'm hoping that what you see in this particular grant is that they're really trying to develop an entirely new research method that is appropriate for integrative health. And they have, as I said, they put forth this initiative. They already have their first round of grants that are being reviewed. And I would say that this provides us an opportunity not to be a lead, but to collaborate, to identify those that are interested in, um, being a lead for this level of a grant, but to be an active contributor on such a grant. So through all of our collaborations and our professional associations, when you hear about people who begin expressing interest in looking at these types of grants, let them know that we have a historical track record of prioritizing training of this type of clinician, that might be a value to, the type of programming that they might be able to argue for within these grants. And so once again, I think that's something we should strongly consider. Okay, that's the same. All right. So I had mentioned earlier that NCCIH had funded the Veterans Affairs, Department of Veterans Affairs, just over 10 years ago. And at the meeting, the head of their program shared a few slides that I want to share with you, because I think this really illustrates the future of what holistic healthcare might mean for us. And so they began to define what whole health care meant within the VA system. And so that involved, a various expansion of clinical care services, being programs, kind of like our Stillwell program that would help promote and encourage behavioral change and direction along that line, encouraging self-care. And then another one that, helps with coaching to actually provide, some support as their veterans take on a whole health care model. And that would involve things such as acupuncture, meditation, massage therapy, and so forth, as you see written in that lower column there on the left. So since over the last 4 years, just in the last 4 years, you can see the number of veterans who have been engaged in whole health services as defined by the VA. And so a significant number of veterans have chosen, this form of care, or have had access to this form of care. And the results are remarkable, and they are expecting them to be disseminated in print in the not too distant future. But they were able to share this for public knowledge. And so for all of these various chronic conditions, as you go down here on the first column on the left, you can look at the number of patients that were involved with those conditions, and look at both before and after, how their health was based off of using standard outcome measures, and across the board, those that were receiving the whole um, health care as defined by the DoD had extremely significant improvements in their blood values, in their other biomarkers, in their lifestyles, health lifestyles, which is really, really exciting. The reason why I was at NIH is because NIH, the NCCIH, is in the process of developing a coalition for whole person health. And this is an independent, self-organized group of nonprofit organizations that are national in scope. And when they made their announcement for this, the ATSU administration definitely felt that we needed to be part of this coalition. I was sent to represent the institution. And at this stage, the last time I looked, there were 85 different nonprofit organizations part of this coalition. And I believe there were about 7 different osteopathic organizations that were at their opening meeting, ATSU being one of them. And the goal is that for these organizations to raise awareness about the work going on at NCCIH and at the NIH, and how research can inform integrative, interprofessional, patient-centered, and whole person care. Um, that this coalition will be key holders for NCCIH, and will serve as a voice for patients, communities, and professionals for whom the NCCIH works to foster and facilitate informational sharing. It is completely an independent, self-organized group of nonprofit organizations, and I will have greater and greater influence as time progresses. In this upcoming year, they are focusing primarily in developing infrastructure, addressing nomenclature-related issues when you're dealing with a lot of diverse professions that are related with whole person health. Okay, so before I summarize, I would just like to see, are there any any questions that I can specifically do before I do my wrapping up?
Dr. Degenhardt, I have one question. Do you know if the CAM supplement is going to be administered next year, or is it going to be separate?
I don't know the answer to that.
Okay.
Sorry. All right, in case other questions do come up, let me summarize. So basically, I'm hoping that this presentation recognizes that over the last 25 years of NIH's work within complementary and integrative health, that it took a good 10 years or more, probably closer to 15, which was just a starting point where they were trying to take an old model of research that was well ingrained in NIH and tried to apply it within an integrative healthcare model. And while they were able to generate outcomes that were similar to kind of pharmaceutical industry research, it was not meeting the needs for whole person healthcare focus. And so over the last 5, 6 years, I hope that you're recognizing that NIH is really at a turning point right now with whole person healthcare. They now have a vision of what is it going to require to actually generate good science within this field? And I think the fact that this is happening, that not just integrate, complementary and alternative healthcare groups are involved, but across all, levels of healthcare research, educational institutions are actively involved. I think this is a very exciting time. Certainly, as an osteopathic physician who has 130 years kind of waiting for this day, being oftentimes a voice in the wilderness, trying to say, there is a different way to go about it. I think it has really, really strong implications for our university, who has remained very strong towards its osteopathic, philosophy, but has broadened that to recognize that all aspects of healthcare needs to really have a holistic framework from which they do their work. In the work that's being promoted by the NCCIH, there are new training opportunities that don't take people out of their jobs, and are new funding opportunities that really promote collaboration. We don't have to go in as the PI and have to compete against people who have long track records of NIH funding. We need to be collaborating with those to bringing our strengths to that table and learning from the strengths of their experience to help strengthen our research infrastructure. To me, this creates a very realistic strategy for our university to remain involved in the modern activities remain related to its legacy of whole person healthcare. Now, without a doubt, there are going to be some challenges here. I can say that one challenge is we don't know where, administration is going to go at NIH. We are at a transition every uh, um, that's just part of NIH. It has to kind of move with the political changes. But in all reality, if it's kind of odd as I struggle with various choices, or not, that the current choice to lead the area that would supervise NIH might actually have a far greater support for the work that the National Center for Complementary and Integrative Health might offer, that it might actually provide a tremendous boom for research in this area based off his own personal perspectives of healthcare. So there can be challenges and there may be opportunities with the new administration. I do think that when we look at this coalition that's being associated with NCCIH, this is not the first time it's happened in NIH. There's another coalition that's been associated for over 30 years with another group, and they have been very, very successful and influential in the outcomes for that particular center. So, but that particular group is really more focused on for-profit organizations and so forth. And so the fact that they are reaching out to nonprofit organizations that have a much more stronger connection to the people they care for, because that is, without a doubt, we would say our identity in ATSU is our clinical work. We care for our patients. We bond with our patients. We advocate for our patients. And they really want, to build a better, bridge of communication so they understand what's important and our patients understand what's scientifically valid and so forth. But it does then create a challenge because we know that these things do provide opportunities to bring in economic influences that has sometimes undermined the scientific system. And so I think that's another challenge that we're going to have to be particularly watchful of because we have a very strong relationship with our patient population that we care for, and we don't want to have that get distorted in any way. So I think in the end, what is going on right now is that in the next 5 to 10 years, the hope that we've gone through our starting point, we're at a turning point in our research, but we want to get to a tipping point where truly the work that we do becomes integrated into the healthcare model. And that is really what we're striving to do. So I hope that this information, you have found some value for your personal work, for the work that's going on within your college and school. And if you have any questions at any time, certainly feel free to reach out to me. Thank you very much.